Welcome to Impactful Conversations. My name is Andy Vaughn, and I serve as president and CEO of the Alliant University system. And we talk to very impactful people on this podcast. And today is a great impact person. With me today is Dr. Dan Gizzo, PhD, a clinical psychologist. We're going to talk about what Dan does. But first, Dan, welcome to our podcast.
Andy, thank you so much. I'm excited to be here and tell you about our work at Kaiser Permanente.
We're very excited about that too. We're great partners between Alliant and Kaiser. So, firstly, tell us about your role at Kaiser. What do you do exactly?
Yeah, so excited to tell you about our programs and maybe give a little background for your listeners first. So, Kaiser Permanente is a large integrated healthcare system, and I'm going to talk about some programs that we run in the state of California in particular. So, I'm the executive director for our mental health scholars programs and for our behavioral health workforce strategy at Kaiser Permanente, and our program's it's an innovative program. So, Kaiser Permanente is, seeing the need to make investments in the behavioral health workforce. And in California, we're doing that through a program called the Mental Health Scholars Academy. And our academy, it's unique in that we give employees who are working in any aspect of our system and our organization an opportunity to go back to school and earn master's degrees to become mental health professionals and actually join our mental health workforce. And we do this through providing various supports, including financial supports, connection to high quality training placements in our clinics, mentorship and education. And obviously, Alliant International University being one of our education partners for the program. So we partner with a number of different academic programs to facilitate employees earning degrees. And it's kind of a new avenue for the behavioral health pipeline for us. And then, I may talk a bit today about some work we do in the community. So we tend to also focus on community, and we do grants also outside of Kaiser Permanente to boost training placements and pipeline programs in the community as well. So really a lot of my work really falls within kind of building and maintaining a behavioral health workforce pipeline, both for our organization and in the community.
The Kaiser brand is so strong, and I think you've said it best. It's the ties to the communities that Kaiser serves all across California and beyond. And I think everyone knows the name. One of the things I love about Kaiser is you were able to see early on the intersection between mental health and physical health, very early before most were able to see that. You're in mental health too. Your PhD is as a clinical psychologist. You studied that, you practice it. Tell me from your perspective, how did Kaiser so early see that intersection when so many did not between physical health and mental health and how one impacts the other?
Absolutely, yes. I appreciate the question. As you said, I'm a clinical psychologist by training. I worked in the field, and I've been with Kaiser Permanente for over 20 years. And so what I can share from my experience is that our program is really focused on a holistic view of health. And so we look at health, it's not just the physical, it's not just the mental, but really a holistic view of the connection between. And I think our unique focus on an integrated care system and really ensuring that our members have the opportunity to engage in preventive care, holistic approaches to mental health and well-being, along with meeting their physical care needs is what makes Kaiser Permanente unique.
The California School of Professional Psychology, and you are an alumnus as well, I know, has been around since 1969. So we're 56 years old now this year. And we have seen a really great move forward in the United States with reducing stigma when it comes to mental health. And really, in the last 10 years, it feels to us, anecdotally at least, that we've come a light years ahead about reducing that same stigma. What are you saying from your chair on the stigmas associated with mental health, and why might people not receive or seek out mental health care, in your opinion?
So it's a great question, and it's something we talk about all the time. Uh, and appreciate the longevity of CSPP in California. We're actually marking the 80th anniversary of Kaiser Permanente in California as
Congratulations.
well. So just calling out those milestones, two institutions with a long history in our state. So, when it comes to mental health stigma, what we've seen is, historically, um, stigma might prevent individuals from seeking care, um, but also it might also prevent individuals from pursuing degrees or career paths as well. And so we view working to combat stigma as part of our mission as an organization. We've done it in a number of ways. We've sponsored a program called Find Your Words, which helps provide educational and anti-stigma messaging out in the community. Um, we're doing a lot of work currently around, we talk broadly about behavioral health, mental health, but bringing in substance use disorders. There's a great deal of stigma around seeking care and for substance use disorders, even just understanding um, uh, those clinical disorders. And so we partnered with an organization called Shatterproof and developed an educational program that kind of breaks down barriers of stigma and understanding substance use disorders. We deployed it with all of our employees nationwide, and so not just our behavioral health professionals, but every employee in every department. So I think it's part and parcel of what we do when it comes to working against stigma. Now, what we're seeing, I think, and what probably you're seeing in the educational space, the pandemic became kind of a it became an accelerator in terms of people talking about mental health in a different way. And I think we have seen an intersection of kind of the anti-stigma work with kind of a broadening discourse and dialogue publicly around mental health during the pandemic. And those two things have come together. And if there's a silver lining to what we've been through over the last 5+ years, it's probably that there's more people that are willing to approach care. There's also more people that want to be a part of that care. There's more people that want to become mental health professionals. And when people can see themselves in those roles, then it creates opportunity for a broader, more diverse workforce for our state. And it gives us a chance to really begin to meet what has historically been a lot of unmet need if you look at the state of California as a whole.
And there continues to be an unmet need. The demand for not only clinical psychologists, but for social workers, marriage family therapists. My spouse is a licensed MFT. You've got clinical counselors, psychiatry, the big five mental health licensure programs in the US. I was just reading an article today about psychiatry and the shortage they're expecting over the next 10 years themselves. Every field of mental health has this extreme shortage. So we're just thrilled that Kaiser Permanente is on top of that, trying to help with those shortages. And by the way, you mentioned so many things why Alliant and Kaiser are partners, and that's our alignment to values. And I think that's really important because it's not always about the outcomes, and that's very important, but it's about how we operate, ethically and with respect. And the list goes on and on about our shared values. Can you talk about how important values are to you in the career in mental health and maybe even with Kaiser? I know you are very aligned with the values that we all respect. Maybe talk about that a bit for you and your organization too.
Yeah, Andy, that's a great point in terms of being a value driven. I think we consider ourselves a mission driven organization, and that brings a set of values with it. Um, but to your point in terms of partnership across sectors, when we pair up healthcare with education, you know, when we looked at launching the Mental Health Scholars Academy, we looked at programs, and one of the things we really looked for was alignment in values of educational programs, as well as their curriculums and their faculty, to ensure that that this would be something that could grow as a joint partnership together. And Alliant has shared connections with like accredited programs, and we interact with accreditors, and so there's a shared value in that. There's a value in terms of approach to patient care, ensuring that that we're training the next generation of mental health professionals to meet the evolving needs of our unique state, our communities. I mentioned there's a lot of diversity in terms of our communities in California, and we want to make sure that we're preparing people to meet the unique needs of all of the population. Um, Language comes to mind. Being able to ensure that we have individuals that can meet the needs of Californians who speak a variety of languages. And so, we appreciate that there's kind of that shared value connection. Um, I would say at the curricular level, in terms of the care delivery models, and also in terms of mission alignment.
How about you personally? What drew you to want to do a career in mental health?
Yeah.
We've talked to so many alumni like yourself, and oftentimes they had something happen in their life where they sought out help and it inspired them to want the career. Others, not so much. But what's your personal story? What brought you to want to be a clinical psychologist?
Yeah, it's a great question. So, originally that was not what I set out to do. I was an undergrad, and I was a pre med and biology major, um, and I actually came to a point where I had to make a decision around an acceptance to medical school and kind of really making one of those early first life decisions, and it was many decades ago. Um, and really, I did a lot of soul searching around kind of what my interests were. And part of the curriculum I had undergrad, I had taken some psychology courses that really resonated with me. And then I had the opportunity to do an internship program. And I was in New York at the time, and it was working with young kids under age 12 with pretty significant behavioral issues. And I really, the work really impacted me. Um, and then from there, I had been doing some actually youth-focused volunteer work, and kind of it all came together in terms of realization that you know this idea of a psychology and mental health career pathway could be possible. I had an academic advisor who was a clinical psychologist, and it was late, and it was well into my junior undergrad year before I actually set a goal of earning a PhD in clinical psychology. So it was a bit of a progression for me to find the field. Um, and honestly, it's been the most rewarding decision I could have made.
Can you relate that same question now within Kaiser for the mental health scholars program at Kaiser? So you mentioned that the employees doing this program or others doing this program within Kaiser and Alliant uh, generally probably don't have a master's degree yet. So they have a bachelor. What kind of jobs are they doing before they enter the program typically, or is it across the spectrum? And what inspires them to want to be a mental health professional if they aren't already?
This has been one of the great learnings of our program. So, we set out to build this pipeline at Kaiser Permanente, bring new people into the field. We weren't sure what the response would be. Actually, we launched in 2020 in the heart of the pandemic, and there's a lot of uncertainty. And we had 40 slots for our soft launch. There'd be two cohorts. One of the cohorts was going to be at Alliant in the Masters in Marriage and Family Therapy program, and I was concerned the night before the launch, what if nobody applies? Well, we got 200 applications for that first launch, amidst everything that was going on in 2020. And that's when I realized that there is a lot of interest in behavioral health careers, but there's also a lot of barriers. So like some of our folks have like they're all bachelor's degrees and they're working in different parts of healthcare. We've got folks that are part of our clerical teams, folks that are in call centers, folks that are supervisors. We've got some consultants. We've got someone that works in our cafeteria services. So really, all different types of roles, and these individuals really have all shared kind of a similar story that they've always wanted to be a mental health professional. They didn't necessarily you know, have the benefit of seeing the pathway, and there were a lot of barriers. Typically to be licensed, you need a master's degree or a doctorate degree. There's a cost associated with that, so there's financial barriers. There's also just sometimes barriers in terms of if you haven't interacted with mental health professionals, or if that hasn't been part of you or your family's media experience, you may not see that role or understand that role. So, um, great deal of enthusiasm for these degrees, all different. I mean, I'm always impressed by the very different departments and roles that our employees are coming from who are becoming therapists. Um, and and really, what we also are seeing is a lot of them are telling us that they're the first in their family to earn a master's degree. And so that tells me also that we're tapping into, breaking down some really important barriers.
Well, I love what you mentioned about showing them the pathway on how they can go from A to B, because that's what drew me to higher education as a young 20-something on the admissions side. That's where I started 32 years ago in higher ed, and providing that clarity to someone that they know what they want in the end, but they have no idea how to get there. And I love that. Sounds like you do too. We're very aligned in that too. So let's talk about that pathway. There's a lot of barriers, as you mentioned, to get a license and a degree, especially on the licensure side, a lot of hours involved. And we don't talk often enough about mental health practitioners as students and their own mental health because they're balancing work. Maybe they work at Kaiser, they're going to school part time or full time, and they're also doing externships, rotations, clinical sites. They are balancing family and friends and other aspects of life, and it really can be a balance. And what I've learned, it's not so much about time management, it's about battery management. We can always find time. I'll sleep an hour less. I won't watch TV this week, whatever. I won't see the movie this weekend. I'll figure it out. But it's that battery power that runs down. How do you counsel Kaiser employees that are doing this program and others about how to balance your battery power and how do you keep your own mental health at stake?
Absolutely. I mean, I think, well, Andy, really, for anyone working in healthcare, particularly over the last, 5, 6 years, it's been really important to find balance, right? There's been a lot that's happened, and the healthcare has been very impacted, over the recent, 5 to 6 years. So yes, we talk a lot about work-life balance, for our program, with our employees, pursuing these advanced degrees. We talk about work-life school balance. And, our goal, part of the reason that, our program's successful is, we're partnering with schools where, you know, the curriculum is designed to be a fit for working professionals. So that creates a little bit of balance. Then, we're also focused around bringing education in addition to the curriculum they get at school. So, we host speaker events for our scholars, and we always make sure that we cover topics, including things like self-care, like therapist self-care, because it's important to learn early on how to balance that, for yourself if you're going to be a mental health professional, right? It's like the old adage about, you're on the airplane. It says, put on your own mask before you help the person next to you.
That's right. I love
Right?
that analogy. Yes, I use that all the time myself. Yes, absolutely.
And so, we want to make sure that people know that are developing as they're learning, they're as they're learning the field, developing those skill sets alongside the academic learning and alongside the very challenging you mentioned, like the clinical practicums. That brings a lot. You're working with real patients for the first time,
You
right?
are.
They're
So
having
big
real
time.
issues, right? And that can, and in mental health, that really can weigh on you. So,
Yeah.
so this is part of our preparation. We provide mentorship as part of our program so that we have mentors that can, kind of provide that informal education that's important in terms of developing the professional identity, which includes practicing appropriate self-care.
My spouse went through a marriage family therapy licensure and degree program. And I think one of the toughest things was the practicum hours and then the externship. You, before you're really experienced, you tend to take in the energy. And sometimes that's in community health, which has some really serious topics involved
Yeah.
in community health, as you know. Wow, seeing people come home at night after being the therapist in some of these deep conversations, which can run the complete spectrum of severity, It's hard not to bring that home with you and have that weigh you down, and you care so much about people. That's who's attracted to these programs, people that truly
That's right.
care about people. What is your recommendation as a clinical psychologist and in your job now on a student going through this program, especially when they're first getting started in those externships? How do you, I don't want to say disconnect or compartmentalize, that maybe trivializes the topic a bit much. I don't have the right words there, but I think you understand what I'm trying to ask. And that, how do you balance your own mental health after hearing a severe situation with your client?
Absolutely. I mean, well, let's face it. You know, people don't tend to come to mental health professionals when things are going well.
No.
Um, right. And so, in general, you may be encountering people when they are dealing with some of the most challenging struggles they're facing. It's a often a difficult time, and I think you're right also. Like, the type of people that want to become mental health professionals, the folks that we see in our employee base, healthcare as a whole, like you have a lot of people that really are invested in helping others. And so, there's a certain burden that can come with that when you're in a helping profession. Um, you know, we look at this. So I look at this, in terms of my role at Kaiser Permanente. Like, we look at it as an organization. And we look at it across not just our mental health professionals, but our nurses, our medical assistants, really, all of our healthcare professionals. And we want to make sure that they all have access to resources to help them. As most organizations, we have EAP type services. But beyond that, we also have other partnerships. So we talked a lot today about academic partnerships. We have partnerships with other organizations. We have partnerships with technology organizations like Calm and Headspace, and we actually make those apps and services available to our employees and to our members free of charge.
That's
And so
great.
I think that we have tools that we can help. So it's, there's kind of, you need layers and you need different tools that are available. So someone may benefit from, just developing a mindfulness practice. And maybe technology can facilitate that. And that's something like we practice day in, day out. Someone else might benefit from taking that to the next level, and maybe some emotional support coaching, maybe text-based coaching with
Yeah.
someone that has some training. Others might need to see an EAP or see a therapist, right? So you want to have levels of that. And I think it pairs with where we started the conversation around that work-life school balance, right? We're finding that balance. And what else do we do on that life side outside of the work and school that fills our battery back up? That,
Yeah. Which we need.
right? It's, for me, it's spending time outdoors. Like, if I have too many hours, it's great that we're here with technology on the screen having this conversation, but too many hours on the screen and I start feeling depleted, right? And I feel energized when I can get outdoors. Particularly, I've got kids, and we can get outside, we can go for a hike. That can really you know, bring my energy level back up. And so I think it's that life aspect of the work-life school balance.
So you bring up technology. I have to ask, how is the AI revolution impacting both mental health, Kaiser Permanente, and what you do in your role? There's some great positives, of course. Maybe there's some negatives. How are
Yeah.
you navigating through AI in your role?
So I think all of healthcare is navigating AI. We're seeing some of the positives, as you mentioned. There's tools that can help take notes during sessions, right? And help take some burden off of a provider. So that's great. That alleviates some work stress. Can you know, provide a little more focus on a patient in an interaction, whether it's setting up an EEG or psychotherapy session. So those are tools that we're seeing that hold promise. I think for me, the most exciting area is really when it comes to training mental health professionals. So at Kaiser Permanente, we have some large mental health training programs. So we have leaders in our medical groups that I partner with, and they run the internships and the practicums and the postmasters and postdoctoral programs, and provide the supervision. And what we're seeing is exciting opportunities to integrate technology in how we train clinicians. So let's say we have a student and they're at Alliant and they're learning motivational interviewing and they're learning cognitive behavioral therapy. we have tools where we can actually set them up to practice with simulated patients before they're working with actual patients to practice those motivational interviewing skill sets or to practice a cognitive behavioral uh, intervention for depression, let's say. And so what we're seeing, if we putting aside the patient care side of it, there's a lot of opportunity for training that I'm excited about because I think it could really help us to better prepare again that generation of mental health professionals that's coming through right now that's going to need to meet complex needs of a very large complex state here in California. So that's I think where the promise is.
So tell us more about mental health scholars in the academy. How does someone get more information about it? How do they maybe look it up on the web? Tell us anything we might have missed
Yeah,
earlier in the interview.
no, no, absolutely. So, I think kind of take home about Mental Health Scholars Academy. So, I'll couch that in, currently the program is an internal program at Kaiser Permanente. So it's not currently open to non-Kaiser Permanente employees. We are looking forward to partnering with some of our academic partners like Alliant International University to try some innovative programs that may bring in some individuals who are not affiliated with our organization. So right now for Kaiser Permanente employees, they can access information about our program through our HR platform. They can access it through our internal website, but we don't have an external facing website. So I do want to be upfront about that because we've started as an internal pipeline program. Um, we do community grants. So we do, we do uh, grants to community mental health agencies to help stand up training programs as well. And so we do have some interaction outside of our organization's walls and boundaries in that way. Um, you know, there will be, I think that the way I would say it is there's more to come for our program. And so it's a little bit of a stay tuned. um, uh, and what we're hoping to do is to kind of set up an evolution of the program. Particularly, we're very invested right now in the master's behavioral health pathway. And so, again, our goal is to bring people into the field at Kaiser Permanente, right? We want to bring new therapists in to help meet the growing need in our state and our community. And so, in that pathway, we're making investments in training programs so we can host students for internships and practicums. We're making some investments in scholarship through mental health scholars. We're also investing in the graduates. So the folks that graduate from your programs at the school, we want to make sure that graduates of mental health degree programs have places where they can land and get the hours required for licensure. The unfortunate thing is that when you graduate, you're not done, right? Right?
No,
You
you're not.
did 3,000
You're just
hours
getting
in most
started.
states.
I know.
It's and
I've lived
so
it. I know.
right.
Yeah.
And so we want to make sure what we learned as we did a scan nationwide was that many graduates were struggling to get to licensure, and that particularly on the master's pathway for social workers, marriage and family therapists, and clinical counselors. We heard stories of individuals who were having to pay for supervision, who were doing volunteer work to get their hours. And so we saw a real need. So we created a program called the Kaiser Permanente Postmasters Associate Program. We now, in all of the states that we're active in our enterprise, we have Postmasters Associates as part of our workforce. And so your graduates can apply for, positions at Kaiser Permanente where they're paid and benefited positions and they provide the supervision for licensure. And so that's, I would encourage your audience, particularly amongst the students who are approaching graduation, really look at Kaiser Permanente as a possible next step in their careers.
That's a great point. I'm going to pass that along to our faculty and our training staff too. That's an excellent point that I was not aware of. So that's a great find right there. And Alliant has grown with our California School of Professional Psychology to be the largest provider of licensed clinical psychologists in the entire United States now. So a large number of students looking for those kinds of hours. And I know I live that. It's an average of about 2 or 3 years post-graduation to get those
Yes,
final supervised hours in. As you live that too, so you know about that.
absolutely. It's well, when I graduated, I had to do a postdoctoral position. You need a minimum of a year to get licensed as a psychologist in California. Um, and so, I remember how challenging it was to find a position that provided the supervision I needed to be eligible for licensure. So it's gratifying to be working at an organization where we're seeing those gaps and we're meeting that need, where we're creating pathways for people to join the field and get to licensure, because that's the maximum impact with these degrees, right? Is when licensure is achieved.
It is indeed. Well, Dr. Dan Gizzo, it's been a pleasure talking to you on Impactful Conversations, and you indeed and Kaiser are all making an impact, and we thank you for that.
Thanks, Andy. Really appreciate the conversation today as well.